I'm Dr. Dan Francis, the host. BackWords, we are going to talk about health and wellness in our local area. We're in Plymouth, Wisconsin, and tonight our topic is going to be about acupuncture. It's a great modality and one we want to learn about, and we're going to break the show up into two portions. Right now we're going to speak with Sarah Atkinson, local acupuncturist in Plymouth, Wisconsin, and the owner of Healthy Living Acupuncture. And after our break, we're going to actually watch her perform it on a patient, and so we can see what it's all about and learn what it treats. So, Sarah, welcome to the show. I appreciate it.
Thank you. Thanks for having me.
We've known each other for about 9 years now.
Yes, we have.
And worked with each other on quite a few patients. Tell me a little bit about yourself and how long you've been here and
Sure.
about the practice.
Well, I became an acupuncturist because I was in nursing school and I was working in hospitals, and I found that I wanted to have more of a holistic mindset on how to prevent illnesses and get to the illness before it became an acute trauma per se. I have lived here for all my life. I grew up in New Holstein, and I started a practice here with you actually about 9 years ago, and I have a daughter, Natalie, and enjoy this community very much.
Good. Sarah practiced with me for a couple of years before she needed a little more elbow room and moved to this beautiful space down here. And so let's talk a little bit about acupuncture. How long has it been around?
It's been around for over 2,000 years. There's a lot of history that goes into the profession of acupuncture. There's historical documents that they've been able to trace back to over 2,000 years ago. However, we're not sure how long it's been past that. For a long, long time. Longer than maybe modern medicine, let's say.
Yeah. It's Chinese origin, is that right?
Chinese medicine, yes. I do practice a traditional Chinese style. It's going to be up to your therapist who, when you pass the national board exam, you can kind of, route yourself in many different ways. You can go Japanese, traditional Chinese, Korean. Okay. I chose to stay with the Chinese style.
So all acupuncturists do not practice the same?
No, they don't.
Okay. No. Just very much like chiropractic, we all are very different in the way we present our practices. It doesn't mean one's better than the other.
Absolutely.
It just sort of fits your personality, I would imagine, what you like to do.
Yep.
Tell me about some of the types of conditions that you treat.
Well, I treat a lot of pain. I treat a lot of pain that is deficiency-based, I like to say. So this means it's not a trauma. It isn't like someone fell. Okay. It's an overuse, a repeated weakening of our tissue or a muscle that then creates inflammation, and inflammation talks to nerves, and then we have pain signs.
So more of a repetitive trauma?
Mm-hmm. Okay. Yeah, chronic pain. People tell me they've been in pain for usually about 6 months or more when I see them.
When you see that repetitive trauma, is that also affected by stress levels, things like that, the
Very
nature
much.
of the lifestyle the person is having?
How
will that affect that?
Right. If you are under a constant overstimulation of a specific muscle, even in relationship to stress, say if it's your upper trap, everyone has their place that they carry stress, but that's going to create sort of micro tears in that tendon, and the tissue will suffer. It'll be what we call blood stasis over time, or chi stasis, meaning different levels of chronic inflammation that pools blood and tissue to then swell.
So you mentioned chi. So let's flip a little bit and describe. That's a word that you hear a lot in acupuncture. Mm-hmm. So what is chi?
That is a very good question. That's a question that has been asked many times with many different answers. I would say, if you ask me, chi is electricity. It's not necessarily the fluids of the body, because we talk about the different levels of fluids, if it be superficial, the blood, the marrow of the bone. Those are different types of fluids that we work with, but chi is more the electrical stimulus that is running through the body, kind of like through the meridians specifically.
So that makes sense to me, because I'm sending people for tests to get nerve conduction velocities and different electrical tests, because there's obviously an electrical current within the body. So that chi and that electricity, are there different types of wavelengths, or is there good chi, is there bad chi?
Yes, and there are some machines that you've probably been able to Google and see. Oh, they're measuring chi. I was taught to measure chi by feeling the pulses. There's 3 pulses on each hand that represent different areas of the body. I see it in the tongue, as in just a visual, looking at color, coat, the shape.
So how would the tongue exhibit that?
Well, if you're really chi deficient, you're going to have a plump tongue, and it's probably going to have some tooth marks on the sides because it's sort of plump in your mouth. So your teeth are going to be kind of pressing into it. There's a pale color that's associated with blood deficiency.
Sure. Okay.
Those types of things.
So then chi travels on meridians. Again, something that you'll commonly hear with acupuncture. How does a meridian lay within the body?
Well, there are 14 meridians that have specific landmarks. They'll go from top to bottom vertically in the front half and back half of your body, and then they'll come through the lateral side of the body, if it be the arm or the leg, and also through the medial side. Again, it depends, though, related to the yin versus yang. Everything in Chinese medicine is described as opposites. So if you understand just those simple patterns of hot, cold, night, day, it has its relationship.
Balances itself out.
Right. So if you have an excess, maybe as an edema in the legs, excess in the bottom usually means deficiency somewhere up here, like the kidneys, which you'd want to then help out with the...
So when you talk about, does the kidney have a meridian itself?
It does.
So then that line does that necessarily travel through the kidney?
It has its specific relationship to it, yes. Same with the liver. The liver has its relationship right there. It runs through that area. It has a relationship. Now there are also extraordinary organs, which there are very useful. I use 8 extraordinary organs all the time, and they don't have a relationship to an organ. They sort of conduct things in a general way, like opening and closing the whole treatment based on certain functions.
So does acupuncture believe that the channel of energy flow is through a particular meridian, or does it cross over meridians, or does it travel on a meridian?
Well, sure, yes. So if it typically is pretty easy for me a lot of times to say, if this lung point here really is hurting someone, I can follow that up and find a lung point here, or just under the clavicle, and those are pathways that can help me to bring relief to that site.
Now, what are the main types of problems you treat on people? Now, you talked about pain, but do you also treat more the source of disease, or is it more palliative?
Sure. We do treat, of course, digestive complaints. That's a big complaint. The GI health, the ability for the body to transform and transport its nourishment effectively is big in the spleen function of Chinese medicine understanding. And we treat a lot of fertility, reproductive fertility for both man and woman. A lot of times it's for a young couple, it's just blood flow. It's just a circulation thing. Headaches, bunch of things.
So you're affecting blood flow when you put the needle in?
Right.
Okay. And that is the key to healing, because blood carries oxygen and nutrients to the cells. So by placing on particular meridians, you can basically access blood flow to an area that an illness is.
Right, and certain points are more for deficiency patterns within that meridian, like spleen 6 is for a deficiency, but 9 is to drain excess. So they have a little job.
So when you put a needle in, like I'll send a lot of people who maybe have hit a plateau in their healing. Mechanically, I'm getting them to adjust great, the motion's great. They're not bridging the gap of that healing process. I'll tell them I feel like they're stagnated. It just feels like you got to get over that edge. And a lot of those people will have muscular trigger points, and those are pretty palpable. How will you treat those? Can you treat that even if it is or isn't on a meridian?
Oh, sure. I always do a lot of palpation, feeling around with my actual touch to feel where is your body having its most difficult time. I may think it's one place, textbook style, but if I don't find it and navigate that myself, and it often is a problem. I definitely say when there is a knot, let's say in the shoulder, we surround the dragon, kind of break it up, and in my form of acupuncture, we break it up and we pull it out. It's very effective to just be more of the investigative practitioner and find out what's wrong.
So how do you determine how many needles you need?
That's a good question. I think it's based on chi. So you come in, let's say, and have a treatment. You have a lot of energy. You're very healthy. I can put 20 to 30 needles in you. Someone that is worn out, maybe traveled a lot, doesn't sleep well, isn't digesting well, is having palpitations, anxiety, they might need like 10.
Okay.
So if I do 20 on that person, I wouldn't be
overstimulate.
I wouldn't be getting what I wanted
Okay.
from the treatment. So a lot of times I ask you to tell me, how was that treatment? How'd you do? Were you okay? Were you tired?
So will people feel different things, from fatigue afterwards to energetic? To some people, I had 2 roommates when I was in chiropractic school. I'd adjust one fella, he'd bounce all over the walls. The next guy would have to go take a nap.
Yeah.
Is that the same?
It is similar. Right.
Okay.
I mean, a lot of times my assistants will have to be real careful with certain people after adjustments, because they'll kind of stumble around a bit. Like, we have to ask them to sit down for a few minutes.
Okay.
Where others are, boom, out the door.
Okay.
Happy to go, full of energy.
How do you determine how deep you're going to put the needle?
Well, every needle has. Deadman is our Bible of acupuncture. To go through acupuncture school, you have to know specific origin, insertion of muscles and tendons and things. But we also really need to know, based off of those landmarks on the body of structure, exactly measurements away from things, and depths and angles.
Well, great. Well, we're going to take a brief break, and when we come back, we're going to go and watch a live acupuncture done. We'll see you in a few minutes. We're talking back, and we're talking spinal arthritis. This is an arthritic vertebra, and this is not. If you look at the disc, this disc has narrowed and this disc has not. This is happening because of improper motion in the spine. These arthritic spurs are a function of redistribution of calcium, not too much calcium in your spine. When those spurs happen, you can see that it narrows the hole where the nerve comes out. This person's going to get leg pain, and they're going to be very sore. It also buckles the disc, so there's less room for that nerve on that front also. This person has lost their range of motion. They're not going to be nearly as active, which again is going to cause more pain. You need to stay active if you don't want to get arthritis. It's a key part of staying healthy. The spine is different than the hips or the knees, where you can really have quite a bit of arthritis and not have pain. So if you don't want to have pain, keep it moving. We'll be right back. Welcome back to BackWords. We're in a treatment room here with Sarah Atkinson, and right now she's going to take us through an acupuncture on Brenda.
Thank you. Okay.
Lead the way.
First of all, we always take tongue and pulse diagnosis. We've seen Brenda's tongue. It looks perfect. But we're going to get through a couple of readings on the pulse, feel how strong she is, and then we're going to feel where her stagnation or her muscle knots may lie.
So Brenda's an elite athlete in the area. She does the Berkey Biner. She's an extraordinary biker and triathlete. So this is a body that's well tuned, and someone that has sort of trigger points from a lot of the abuse that she puts through it.
I think we'll also take the needles then next. We'll go right to it.
Do you need this?
Yeah, I can. Thank you.
So these needles, how thick are they?
I like to use a 36 gauge
Okay.
needle. This is going to be a needle that's about 2 inches long. We're
Okay.
going to thread these in the back. The shoe points at the back are always threaded at least 35-degree angle. And we usually go through the muscle tissue that's stagnated or affected a little bit toward the spine.
Now, what is this?
And this is the guide tube.
Okay.
We could take the needle in our hand and insert it very quickly and do that by hand. However, with a longer needle, if we introduce that guide tube, I can only touch that end shaft.
Restricts how far you insert it in?
It gives me a nice clean field to work with too. I never touch the needle.
Okay. Okay. Cool.
Okay. I don't know if we can see these, but she needs them. We have to give the stressors that are in her upper back, they need to have an exit strategy for their effective healing process.
So does that have to do with the meridian?
It does. So I've seen the area here on her shoulder blade affecting the bladder channel. So ideally we would have a lower point there. But on the upper channel here, affecting the top of her shoulder is the large intestine channel. On the side of the channel, the arm, will have a distal insertion of LA11 to pull that down.
So when you put that in, does that hurt?
The insertion is pretty quick. If anything, they might feel a slight mosquito bite.
Okay.
But Brenda, what do you think?
It doesn't hurt.
It doesn't hurt. Do certain areas hurt?
The muscles not?
No, I can feel when she's got the right spot.
Okay. You know where.
Some achy sensation?
Yes. Yep.
What's that achiness from? Is that from stimulating the chi or the energy?
I believe it's the body using the needle effectively. So yes, the blood flow is going toward that site, and it's also dissipating stagnant blood, old blood.
Okay.
So
that needle you put in about 1.5 inches. Right.
And I could go further. The angle is a little bit more into her. It's a pretty strong knot right there.
Okay.
So when you feel the needle initially, it inserts very easily, and then you can kind of feel it slow you down.
The tension because of the knot? So do you have to use, if you use too thin of a metal, would you have a problem with that?
Yes.
Could it actually bend it?
Exactly. Sometimes we have to use a thicker gauge, which would be more of a 32 gauge.
Okay.
Unfortunately...
This is a 36 gauge?
Right.
It's sort of like a shotgun. It gets thicker.
Right.
Or it gets stronger as with a shotgun. Okay.
You bet. When we look at our diabetic patients, people who have thicker skin, men in general maybe have, we could generalize, we would have a stronger muscle mass to get through. The larger gentlemen, I guess I would tend to do that with, especially if you are a weight lifter.
See, now that one's about 1.75 inches. That's a sweet spot, but you've got it at a pretty steep angle, so it's actually not going very deep into the body. You're going along with her fascia almost.
I am, and there's a lung under there, so we have to be careful.
We'd like to puncture those.
I like to go around where the stagnation is, where her tension is, and you can see when you touch. Now, of course, the skin also tells us that there's a little something there.
So you do a lot of palpation.
I do.
This is as hands-on as chiropractic, really.
Well, I think you have to use more muscle than I do, but yeah.
Yeah, but still. Now, there's a lot of red response there, a lot of blood flow going on.
There is.
You could probably see it with the camera starting over at this angle. These over here are a lot more advanced in their blood flow, but is that what you look for? Are you looking? Do you look at that as a positive response?
I do.
Okay.
Yeah, but we call it a histamine reaction, but I just see it as, wow, there's a lot of blood moving through this.
I've had this done. I've never seen it done, so that's sort of cool to see it from this angle. So was that you just having a hard time getting that in,
Yeah.
that multiple pushing?
Well, and I want to reroute the angle. Sometimes
Okay.
with these longer needles, I have to be very careful. I stay true to my angle.
Brenda, did those hurt at all
No.
going in? That's what I find. I find the only place it hurts or pricks is near my fingers or my ear. Why do you do the ear when you do it on
The
me?
ear. The ear is a microsystem of the whole body.
Okay.
So for her, I could do a shoulder point and neck point. I could put a liver point in because I know she's a working mom.
Okay.
There's a lot of stress in modern lifestyle. Women and men have different systems. Women menstruate, have children. There's some different effects that life has on women and to men.
And their hormonal system, and that
Complex.
affects then the physical system. Yep.
Women are complex.
Yep. You know that?
So I'd like to demonstrate as well some acupuncture modalities. We do like to do something called gua sha with Brenda a lot. And sometimes people ask for just that therapy, and that's okay. I do encourage the whole acupuncture and cupping or gua sha. It works better, I feel. But, everybody has their own plan. A lot of people use
So do you perform that after you're done taking the needles out?
after we're done.
Okay. So I have a couple questions for you on this. When I look in here, these needles, her skin is actually sort of suctioning in at the insertion site. What is that telling you? And then there's one that's mildly tenting up.
Right.
What do those signify?
Theory would be that when we see that, where we see more, for instance, this one's indenting a bit, we would want to either stimulate in, or we would tonify. We would spin in a tonification manner.
That means to tonify.
Tonify, or to the right, to the left. We would also have a few other options for excess conditions. We would actually pull out, stimulate and pull out.
So after when you come in, after a while I've been laying down, or when Brenda was laying down on a regular session, you leave us go for a bit, then you come in, that's what you're doing. You're checking those points and either tonifying or stimulating or...
I'm encouraging it.
Yep. Okay, so you're touching it up as we go. How long is a typical session?
We would like you to sit here for 15 minutes at least, minimally. Some people ask for more time, which is great. 20 minutes would be about average for people with the needles in.
Okay. Well, if we're going to show them gua sha, we
Okay.
should probably start taking these out.
Sounds good.
I've got the hazardous waste where the needles go and get disposed of. That's amazing. She's got this red response throughout. There's just a lot of blood flow coming, not so much in the hand, not so much in the elbow, but boy, on her back. Brenda, that Berkey biter sets you on fire.
Oh, that good old left side, huh?
Now, does that hurt coming out, Brenda?
No, it's
No?
just a little prick.
Yep.
And sometimes there's a drop of blood, but it's easily managed with a cotton swab.
Good. Perfect. All right. In and out. Gua sha. Which one do you want?
Do we have time for both or one?
You've got a couple minutes.
I have some oil first. Let's try showing what it's like to do her gua sha.
Okay.
I think it's her favorite. If there's time.
Now, I call this tool the Grasson tool, correct? The metal tool?
Yes.
Yep.
This is
I use this for
actually
soft tissue. Yep. They're
your invention.
just fabulous.
So we put oil on the skin, and it acts as our lubricant so that we can stimulate by scraping in one direction, short strokes. I prefer, I don't know, everyone's a little different. We always want to miss the major landmarks, such as the
Bony
spine.
spots. This is nice on meaty sections of the muscle. It's not so good over bone. The metal does not feel good on bone. So I use this on trigger point areas. I've got a bar up for the neck. I use the low back, the glutes. It's a great, great tool for breaking up scar tissue and drawing blood flow It's hard to see, but there's a real nice red response there. Draws a lot of beautiful blood flow in. It really helps the healing process. And I find it's just amazing what happens afterwards. It breaks free their range of motion. It's just such a great tool. A great tool.
Do
That's
we have
great.
a minute for the cupping, or are we?
Yeah, go ahead. I'll give you this.
Okay. So all I need to see is a cotton swab, which I think is here.
Here you go. Oh, you have one?
I think I'm going to try this one.
Okay.
Want me to-
That's fine.
So this one, we have a few cups here. It's going to land right about there. If we want to have one ready to go too, that would be good. So we have a little flame. Hopefully we have a flame.
Yep.
I need more alcohol in there to get a good flame. There we go. I think I have a...
That's okay. Just do one. That's
One?
fine. Yep.
Yeah, that's going to be what happens when cups are going to make it a little suction. You see the tissue kind of coming up a little bit.
Okay. That draws blood flow.
Draws blood flow.
Okay. Well, we are out of time. But thank you for joining us. That was a wonderful experience. And thank you for joining us at BackWords. We'll see you next time. And remember, until then, we've got your back.